My guest today is Dr. Eric Weiss, MD. Dr. Weiss is board certified in plastic and reconstructive surgery and a regional leader in advanced regenerative medicine. This practice offers umbilical cord stem cell therapy as regenerative medicine treatments, including treatments for autism. In addition, these treatments are offered for osteoarthritis, rheumatoid arthritis, wound repair, and traumatic brain injury. Dr. Weiss attended College of Medicine at Duke University on a naval scholarship. That's right, Dr. Weiss is a veteran of the U.S. Navy. He completed residencies in plastic surgery at University of Miami, General Surgery at the University of California in San Francisco, and General Surgery at the University of California, Davis East Bay. Umbilical cord stem cells are living cells that are transplanted into the patient. These living cells must be alive during the infusion process. An industry standard is between 40 and 60% alive. However, Dr. Weiss and Duke University is seeing over 90% live cells during infusion process. So we're going to have Dr. Eric Weiss join us and tell us and learn all about this process. And now, my conversation with Dr. Eric Weiss. Dr. Weiss, start with telling me a little bit about your medical journey, some things that were interesting, you were interested in, and just take us up to the point of the autism research.
Okay, well, I went to Davidson College, and then from Davidson College, I went to Duke University Medical School. And Davidson and Duke are linked by the Duke brothers, and Duke University used to be called Trinity College. But if you give anybody enough money and ask them to change their name, they change their name. In fact, I think they asked Princeton first, but Princeton wouldn't change their name to Duke. So they gave the money to Trinity College, and they became Duke. But they gave a little bit of money to Davidson College as well. And so Davidson's kind of a feeder school to Duke Medical School. So there's a lot of people from my class that went to Duke University Medical School. After that, I went to University of California, San Francisco, where I did a residency in general surgery. Then after general surgery, I went to University of Miami and did a residency in plastic surgery. And then after that, I went to the United States Navy because the Navy sent me to medical school at Duke, which is very nice of them. And so I went into the Navy and was a plastic surgeon, and then eventually got out of the Navy in 98 and started my plastic surgery. And my journey to stem cells and to autism, I think, revolved around two things. One is when I was at UC San Francisco, it was a hotbed for research. They were doing surgery on pregnant sheep because there were some congenital anomalies that are found in humans that make it incompatible with life. You can live in the fetal environment, but as soon as you get born, you die. And one of those is called hypoplastic left heart syndrome, and that's due to a congenital diaphragmatic hernia. And so at that time, they were getting sheep pregnant. And then in the first, trimester, they were opening up the uterus, taking one of the baby or the fetal, lambs out, opening the chest, creating a diaphragmatic hernia, putting it back in, and then letting it be born so they could study how to do that. And what they found out was if they do this injury too soon, not only is the sheep born without a scar, but the defect was fine too. That somehow it fixed itself. They cut a hole in the diaphragm instead of being born with a hole in the diaphragm. They were born with a complete diaphragm. So the big question is, how are these fetal, sheep healing by true regeneration and not scarring? And so that was a big question. And that research was done by a pediatric surgeon, but it got picked up by plastic surgeons. And I was going to be a transplant surgeon. And in my year, I think 9 out of 11 of the chiefs went into plastics because of this research. So I had some kind of regenerative medicine in my background due to my early training. But then my son was born with autism, and it obviously became a lifelong passion of both my wife and I to heal him, any way we could. And there was a landmark article in 2005 from Johns Hopkins because autism rates were increasing, and they said we need to look at some fresh brains from people who died from autism.
Yeah.
And so they did that, and kids that died in car accidents, kids that died house fires, drownings, anything. And what they found out were there was brain inflammation in these kids. There was something clearly different about their brains than normal brains. And this was the first time that was described. And as soon as that happened, the people at Duke, picked up on it. And I'll get back to how that happened. Is that the traumatic brain injury research people, with chronic traumatic encephalopathy that were happening with the football players and soccer players was in the news. And they had discovered that you can get a concussive blow to the head or even a subconcussive blow, and then 20 years later be 30 times more likely to have dementia. And what happens to the brain with just a very small blow? And what they found out is some people develop neuroinflammation. And they did 30 different trials trying to figure out what they could give that would be neuroprotectant. And then the 30th thing they tried was umbilical cord blood, because some other researchers found out that it really acted on the immune system. And as soon as they published a paper saying that for traumatic brain injury, it looks like umbilical cord blood may turn off brain inflammation, the people from Duke said, wow, cerebral palsy is a brain inflammatory problem. So they took kids with cerebral palsy and gave them umbilical cord blood. And it got fabulous results. Almost 90% of the kids got measurably better. And I mean crazy stuff. Kids in wheelchairs started walking. Kids who couldn't see started seeing. And then the next thing was, well, let's do it with autism. We know from that one report that it looks to be a neuroinflammatory problem. And then the people at Duke did it. And sure enough, about 65% of the kids got significantly better. And when I say significantly better, I don't mean marginally better. I mean better than can be explained by anything else except what was given to them. And a single dose of umbilical cord blood was shown to grow more brain connections by MRI, that their EEG started to normalize because kids with autism have a different brainwave pattern. Yeah. It has less electricity, but more importantly, they have abnormal ratios of alpha waves to beta waves to theta waves to delta waves. And those started to normalize. And then by sophisticated objective measurements, their socialization skills got better. And so as soon as I read that, I knew from my previous training that this could be the answer. And so, having trained at Duke and at UCSF, it was nice that I could call Duke and I knew the people there. The woman who was doing the research, Joanne Kurtzberg, she got there as an intern during my fourth year of medical school. So we were only a year apart. So as I was rotating through the hospital, she was only 1 year above me. And in fact, she married, somebody we knew as well. So when I called there, they were very nice and said, Eric, we're seeing some amazing stuff, but due to our protocol, we can't treat your son. He's too old. And I said, well, do you think he's too old to get a benefit? And they said, no, certainly not. But we don't know. We don't know for sure. Nobody's ever treated adults. And I went back to the original paper from Hopkins. And even though the study was on kids, they were sent 2 brains of adults. One was 33, one was 42. And both those brains had the same, identical neuroinflammation like all the kids did. So I figured it was a lifelong problem. And so my wife found a tremendous physician surgeon in Chicago who was doing a pediatric brain injury study. A doctor named Thomas Loeb, who, famous. He was the head of pediatric surgery at St. Jude's Children's Hospital, and they had pioneered stem cells for pediatric leukemias and lymphomas. So he was very adept at it, and so he was doing a brain injury study. And I called him. One day we talked on the phone for about an hour as I was driving home, and it turned out he was trained at UCLA when I was at UC San Francisco. We knew people in common. And the more I talked and the more we talked, the more he said, why don't you bring your son up and let's give it a try? We know it's safe. This stuff has been given medically in the United States for 60 years. So the safety profile is very well known. There's 80 different diseases that umbilical cord blood treats. And so this is not new to medicine. It's just new to autism. And so we knew that it was very safe. We knew how to give it. And so he did it, and we saw remarkable results. He was one of the responders. And that's how it all evolved. And then obviously, happy life, happy wife. My wife convinced me, pushed me into this because she said, are you going to do this for our son and not offer it for anybody else? And I tried to convince her. I had a day job. And so it started off on Friday mornings, and then it involved, the Fridays all day. And then it went to Wednesday mornings, and then it went to Wednesdays all day. Now it's on Tuesday mornings, Wednesdays all day, some selected Fridays. And so very soon I'm going to give up operating and do this full time because it's very rewarding. We see tremendous results. It doesn't work on everybody, which we're still trying to figure out, but it works on about 70% of kids. And it offers hope to not only the children, but the parents, because we talk about neurodiversity and it's good and everybody, wants to love the person the way they are.
Mm.
But if we can help the person interact with the world a little bit easier, it just will make their life easier. It's like saying, well, let's don't cure paralysis. We can get around fine in a wheelchair. Well, you can get around fine in a wheelchair, but in some instances, it's nice to be able to walk as well. And this stuff is starting to show promise in spinal cord injuries. So there's going to be a tremendous, I think it'll be the single biggest thing that happened to medicine since antibiotics will be harvesting the healing powers of umbilical cord blood.
Wow. That's very fascinating. How old was Marston at the time?
Well, Marston was 22. And, and anybody who was I talked to had never done it to that age. I actually called Panama, and their cutoff is 18. But Dr. Loeb did it at 22, and he got remarkably better. He had probably 20 to 30 words. He could put two words together, mostly speaking for function. He would say bathroom, and you knew he wanted to know where the bathroom was if we were in a strange place. But he started making changes almost immediately. He started, asking questions. We didn't tell any of our family we did it. It probably had a month, maybe 6 weeks, our niece called us and just said, what the F's up with Marston? And I'm going like, what do you mean? Is he okay? I went to his bedroom, and he goes, no, he just called me on the phone. And Carly was only 1 year above him. So, he was 22, she was 23, and he kind of grew up with her. But that was the first time he ever used a cell phone to initiate a call. And he was just kind of missing her. And he said, he asked me about my boyfriend and et cetera, et cetera. And so that's when we really knew something crazy was happening. And then everybody else started saying, something's different. He's talking more. He's acting, he's following commands more, and it just, his life blossomed.
Wow. Yeah, I'm almost thinking like as he initiated that phone call, previously, we could just imagine how much he wanted to interact and how much he was just so curious about others and wondering maybe even why he couldn't do that or initiate that stuff. And it was
Correct.
just,
Oh, I think it was frustrated.
yeah,
Because
yeah.
as he started to talk, he said, I wish I had Austin's brain, which is his older brother. So he knew it was more difficult for him to speak, but it was just like when he was young. You could say, "Go get your purple pajamas," and he could do it, but he couldn't say purple pajamas. And you think of the people that were completely conversant and used to talk and had a stroke and can't talk
Yeah.
now. It must be incredibly frustrating to to have something to say and not be able to say it, but it certainly freed up his life.
Yeah. That's incredible. Just just sitting here trying to imagine this that frustration that he went through, and others as well. There's plenty of others. As you describing, it kind of sounds like he's more level 2 or level 3, as the new DSM describes, that needs substantial support. But can you explain to me about what it is exactly in this umbilical cord that is being infused or transplanted into the recipient?
Yeah, I will. It's Well, first let's go back and we'll talk
Yeah,
neurophysiology 101 here.
sure.
Is that your brain is full of neurons, and those are very specific cells, so specific that they really don't metabolize glucose too well. They don't do a lot of things well. So they have these support cells called glial cells that live right next to them that help them exist. And these glial cells can exist in three states. They can exist in the neutral state, meaning not much has happened. They can exist in the pro-inflammatory state, which means there's some type of insult and they're secreting inflammatory mediators. And those mediators cause the neurons to die off, something called apoptosis, and it breaks up connections between neurons. And it's been shown with kids with autism that they have less connections in the areas of speech and socialization and language than other kids. And the third state they could be in is a brain restorative capacity where they're causing new connections and new cells coming in and they're making everything right again. And it's been shown in certain situations, whether it's trauma, infection, inflammation, that you can get stuck in that pro inflammatory state. And so when the researchers in traumatic brain injury were looking at it, they found out that the mesenchymal stem cell, the MSC, which is found in umbilical cord blood, has the ability not to act on the glial cells and not only turn them from the pro-inflammatory state, but they go back to neutral, but all the way to the pro-restorative state. And they secrete something called brain-derived neurotrophic factor,
I
BDNF,
was going to ask you about that.
right, or something called nerve growth factor.
Yeah.
And brain-derived neurotrophic factor makes more connections. It causes cells and neurons to come together. And nerve growth factor causes your own brain cell, your us brain stem cells, which live in your brain kind of in a faraway area, to migrate to the area and make more neurons. So when you infuse these cells, they're very it's an amazing thing what they do, because when you get the umbilical cord blood transfusion, they get trapped in the liver, lung, and spleen. So all the cells get trapped in the liver, lung, and spleen right away, or not all of them, about 95%. Then starting on about day 8, they start migrating back into the bloodstream. And then they just circulate looking for things to do, looking for inflammation. And if you look at the experimental animals, and there are experimental animals for autism, that by day 8 is when they start to migrate to the brain. And by day 14, they're all in the brain. And they have the ability to cross the blood-brain barrier. And people aren't sure how they do it, but they know they do it. And as soon as somebody published, by day 14, they're all in the brain. The people who were using stem cells for leukemia and lymphoma, they wrote letters to the editor of the journal and said, we saw something very similar. We've been using stem cells for 50 years. We infuse them. We don't have any idea where they go, but we know at 3 weeks they're all in the bone marrow. And since we've done it 10,000 times, we don't worry about it. And so it looks like that's a property of stem cells. Because when you radioactively label them, or when you label them with immunofluorescence, and let's say you inject them in a puppy, they can circulate for 2 years because there's nothing wrong. But if you put them in an aged dog with bone problems and brain problems and heart problems, they attack the problem, right away and get used up right away. So back to your original question, it's a simple IV. It looks like the MSC or the mesenchymal stem cell is the heavy lifter, but I'm not convinced of that. If you look of what's in umbilical cord blood is like chicken soup for healing. There's 5 different types of stem cells. There's stem cells for the heart, there's stem cells for the liver, there's stem cells for the gut, there's stem cells for the lung, there's stem cells for the whole immune system, and this MSC. And there's also something called an undifferentiated somatic stem cell, which may be the precursor for the neurostem cell. People aren't quite sure on that. And on top of these stem cells, there's something called natural killer cells, which help you with viruses. There's also something called T regulatory cells, which are really good for the immune system. So it's been shown that kids with autism also have inflammation of other parts of their body, the gut and the skin and stuff like that. And so these help that as well.
Autism and GI problems are so common.
And yeah, and it's such an easy treatment. It's a simple IV. Now it might not be simple to start an IV in an autistic child because they're very frightful. But once the IV is in, it literally takes minutes. You infuse it just like you would infuse IV vitamins. It goes in over the course of several minutes. And I think that, I'm uniquely, I want to say qualified, but I think parents find me unique is for 2 reasons. One is my son got this, and I did it for my son, and I've seen it work. I understand the science. When you call my office or set up a consult, you actually talk to me. You don't talk to somebody in between. But the second thing is, as a surgeon for the last 30 years, it's very easy for me to sedate people, and sometimes these kids are very frightened. And I can give them a quick shot, or and then they just relax. We start the IV. We have it timed pretty well. They wake up in 20 minutes. The IV comes out. It's all done. And it's just, it's not stressful on the parents, the child, or even me. Nobody wants to hold the child down and to put an IV in.
Yeah.
And obviously, if they don't need sedation, we don't sedate them. But it's a simple treatment, and I believe it's the only thing that you can do to change your brain at a cellular level.
Wow. Okay. Or the person that's giving the blood, the umbilical cord blood, what's that like? How do you select that?
Well, it starts with the OBGYNs. And so almost anybody gets offered, you want to save your own stem cells for you. Okay. But that can be costly and pay yearly. But then they usually follow that up. Would you like to donate your umbilical cord and your umbilical cord blood? And they say, yes or no. But if they say yes, so the hospital knows they're going to donate it. So a woman has a baby. And all these are live, healthy births in the United States. And as soon as the baby's born, the umbilical cord blood is harvested, and then the umbilical cord is harvested. They're placed in a solution, and they're FedExed to the lab. The lab is in Las Vegas, and it's in Las Vegas because there's more direct flights to Las Vegas than any other city in our nation. And they have to be processed within 48 hours. And so they get processed, they get placed in the freezer. And then at that time, they're waiting on data. They're doing genetic screening of the mother and father. And they're also, checking the mother for infectious diseases. So the mother, gives her blood, and they're checking from, HIV, human T-cell leukemia virus, Lyme's disease, Chagas, CMV, Zika, West Nile, anything you can think of. It's all that, hepatitis A, B, and C. All that's getting checked. And it takes about 8 weeks to get all that data back. And then once the data comes in, obviously the lab looks at it and says, is this a go or a no-go, depending on infectious disease, genetic screening, and stuff like that. But before it can be released to the public, it has to be looked at by a third-party physician, who looks at it and agrees with them. And then it goes on a public bank. And most people don't know that There's a public bank, just like if you were going to donate a kidney or something like that, because bone marrow transplants really aren't done anymore. You don't hear about bone marrow transplants. And that's because a whole immune system can be reconstituted from umbilical cord blood now. And so, like I said, there's 80 different diseases that are treated with this stuff. Some things need to be HLA matched with the mother, most not. Uh, but as soon as it's put on the public bank, then we can use it for autism. And the nice thing about it is that these cells don't have the ABO blood markers. They don't have HLA markers yet. So they're generic cells. They can be given to anybody.
It kind of sounds like once they're given or once they're infused, the body already knows what it's going to do with them. Like you don't have to manipulate them or kind of direct them. Just the
No, no. I feel like it, it, I'll give you a quick story, which is how this whole thing was started, which really was amazing. At least to me, it's kind of amazing.
yeah.
Back in the 50s, we win World War II, the Russians get the bomb, Cold War is in full swing, and the government, makes our medical researchers look at, radiation fallout, just in case, we get nuked by the Russians. And so they were doing radiation research on rats, and they just noticed that young rats could tolerate radiation injury much better than older rats. And somebody got the idea and said, why don't we sew an old rat to a young rat and see what happens? And so what they did was they did that. They made them kind of like conjoined twins. Then they radiated the old rat and it healed like a young rat. Then they said, well, let's injure a leg. And they injured a leg and it healed like a young rat. Then they looked at the metabolic activity. Well, how many liver cells does it make per day? How many, gut turnover cells? And what they found out was the biologic clock of the older rat got younger. And they said, what circulates in young animals that gives them the quality of youngness? And that question was asked like in 1957, but it took decades before we figured out there's something called the adult stem cell. Most people, which heal, most people,
Yeah.
there's two big types of stem cells: embryonic, they make a baby; adult, they heal. So these are adult stem cells designed to heal. They're designed to circulate in the body, find things that are broken, and fix them. And so there's very little manipulation. You infuse them and let them do their thing.
Oh, wow. I've always heard that I haven't always heard, but recently, over the last maybe 2 years, that I heard that bone doesn't heal; it just regenerates, and you can't find a scar on it. Have Is that something you're familiar with?
Yeah, well, first it develops something called a callus. When a bone breaks, uh, and the question is, how many living cells are in the bone? They're mostly calcium and stuff like that. Uh, and so they get made. A callus forms, which just looks like a callus on your hand. It's a bump on a bone, and there's a lot of metabolic activity, but it lays down a sheet of calcium that gets remodeled exactly like the old bone. And so radiographically, you're right, there's no scar there. And that's just because if you think about it, it's more like a hole in your drywall, and it gets patched and polished and sanded with the exact same stuff so you can't see it.
It's a good
As,
analogy.
as opposed to a skin injury, which there's that fine line of scar where there's no skin. But I believe with these cells, we're starting to get stuff. As a plastic surgeon, I've had huge traumatic injuries where I've treated that with stem cells, and the scarring is down 98%. And so there's people working on scarless healing now so that you can have an operation and not have any scar afterwards.
Based on the timeline of the 1950s and everything you just said there, and regeneration, I'm reminded of a guy named Robert Obecker who was kind of canceled, which is kind of reminding me of like this whole process right now. He did legendary work with regeneration. he has the DC electric effect. But what makes you think? And I want to kind of ask you about, are there trials or clinical trials or whatever? Why is this more popular?
I think there's two things. One, first, it's new science. So it was really kind of written about and exploded on the scene in 2019, followed by the pandemic, where everything kind of got shut down.
Yeah,
And so it's been up and running and things are happening. But it it's exploding regenerative work, just like the DC currents and stuff like that.
yeah,
We're starting to find out that cells migrate to electricity. We're finding that when the sunlight hits your skin,
yes,
there's changes in your gut. That photon of energy gets transmitted. And I think we've done a disservice to people. Keep your clothes on, slap sunscreen on.
I'm loving it.
And sure, you're not going to get a skin cancer, but you're not going to be as healthy either.
Yeah,
And if you look at people that work outside, their skin cancer rate's pretty low.
yeah,
And none of those guys got COVID. You know,
yeah,
COVID didn't blow through the homeless population or the people working outside. And so I think this renaissance in healing, which is happening, is going to be the biggest change we've seen in medicine. I think that we're just scratching the surface on this. We
yeah,
know now that people with congestive heart failure, where your heart's not beating effectively, not everybody's a candidate for a heart transplant. We know now with an infusion of umbilical cord blood that your ejection fraction, the efficiency of your heart, gets better just by a simple infusion that's measurable and quantitatable. And so I think um, after a heart attack, this will be first line therapy. After a stroke, this will be first line therapy. Spinal cord injury, brain injury. It looks like it's going to be effective in Parkinson's disease, Alzheimer's, multiple sclerosis. You know, I think in burns where you lose skin,
mm,
it's going to start to, because your body has the ability to heal itself. And the biggest problem we see is that uh, you're born with a bank of these adult stem cells, and it goes down very quickly. By the time you're through your teenage years, you've lost 90%. And by the time you're in mid 30s, you've lost 95%. And so once we learn how to give these cells, we can do
yeah. You're spot on, 100% over the target on the sunlight and healing. It's electrons, and
it.
I
Right.
think that's what caused autism is the lack of electrons.
Hmm.
Uh, and people going out in the sun don't get sunburn because they get more red light in the AM, which preconditions for the UV light. And with the gut, it's 100% true because the enteric system and the bacteria emitting light and all of those aromatic amino acids are synthesizing those things like serotonin and dopamine and all of that, which is crucial for the
Right,
development.
right. This whole gut brain axis, we're just trying to figure out.
Yeah,
I've had several patients. Gut issues go with autism,
yeah,
and the nice thing about infusing this stuff and let it work. I've had kids 7, 8 years old, 9 years old, 10 years old, not potty trained. Chronic diarrhea, chronic constipation. Get this treatment, and within days they start to have normal bowel movement. Within weeks they're potty trained, but then they start to get better, and so these stuff migrate to the areas of most concern, and it might be the brain's not the area of most concern.
yeah,
I talked to a parent today where they've had gut issues from the word go. The kid's 10. And I said, the nice thing about this stuff is, I don't have to be a smart doctor. The only smart thing I have to do is give this to your kid and let the cells figure out what needs to be done. This is not big pharma. This is something that God gave us, and we just have to live a healthy lifestyle. We need to get outside. We need to walk. You need to be grounded. You know, breathe fresh air, breathe salt air if you're close to the ocean, and let your body heal.
yeah. Evolution gave us these, either God or evolution gave us these, and we should utilize them. Evolution wiped out the randomized controlled trials. What we have works as long as we can properly utilize them.
Right, right. And this stuff should get start, in first grade, you should get it. You should get this stuff. You, you know, uh, and I've just seen amazing things, autism primarily, but, now I'm starting to do neurodegenerative disorder. I had a woman come in with Parkinson's who was using a walker. It's shaking, and in one dose, she's walking more normally. She's not using a walker anymore. Her brain is better. And so we have these cells which are there to fight inflammation. And the interesting thing, which I think is very interesting, is that these cells can turn into fat cells. And most people don't understand, with a poor diet, you're eating inflammatory things, and fatty acids are inflammatory in your bloodstream. And so the way to get those inflammatory things out of your bloodstream is for these cells to turn into a fat cell, and then that takes the fatty acids out as a fat deposit. But it also makes your bank smaller. And so with the obesity epidemic in the US, and the people that are overweight, they even have less of these cells, and so it's all about living a healthy lifestyle, eating normally, decreasing your inflammation, getting sunlight, using your body's natural ability to heal. And you could heal probably damn near anything. I mean, there's going to be a role for traditional Western medicine. Don't get me wrong, but most doctors aren't talking about how to prevent disease. They're talking about how to treat disease
Yeah, that's the medical
when
paradigm.
when you should be trying to prevent it.
Yeah, the obesity I think is a loss of electrons as well in the mitochondria. They're not getting those electrons, and they're not pumping out water and cytochrome C oxidase, and they're just not pumping out ATP. They're losing energy to the environment.
And that concept, you know more than most. But if you get down into the nitty gritty, because we don't talk about the nitty gritty on how these mesenchymal stem cell works, because most people just want to know that they work, but
Mm.
they work by something called paracrine activity. And so when they sense an inflamed cell, they migrate to the cell, and they make something called an exosome. They make a little packet of information which goes from the stem cell to the inflamed cell. It goes inside the cell, fuses with the nucleus of that cell. It gives it the proteins and the signals to heal itself. But the one of the things that it fuses with is the mitochondria, because it always comes down to mitochondrial dysfunction, and especially with age. But
Yeah.
but starting much earlier than most people think, in their 20s, your mitochondria need support,
Hmm.
uh, which is why there's these supplements, MNN and NADH. All these things help support healthy mitochondria. But that's how these things work, by actually changing the cell and affecting the mitochondria.
Okay. As we age, our ability to make water and cytochrome C oxidase and the mitochondria are decreasing, and I think this might help kind of level that back up.
Right, because they don't make ATPs like they used to.
Yeah.
So you're losing cellular energy. So the processes which were crucial are starting not to get enough energy to be at peak 100%. Now your cytochrome P450 is at 95%, which is not so bad, but it's not 100%.
Yeah.
But if you can drive that to 100%, because the goal in life is your health span to be equal to your lifespan, you, you know, and so nobody wants to be in a nursing home,
Yeah.
in a wheelchair on oxygen, with dementia. You want to live a healthy life, uh, you know, and then collapse and die. That you win life when you do that.
Yeah. It's all of these conditions, all of these modern health conditions started after electricity and artificial light was invented because we're just getting isolated light. Isolated light is no good. You need the full spectrum of light.
Right. When we went from a farming people to an industrial people, and people started working inside, then they're tinting even the windows of buildings so they
Yeah.
don't have to heat them. But natural light is just good for you
Yeah.
all the way
Well,
around.
all of these rates, including the rates of autism, follows humans removing themselves from the sun and getting under artificial light both day and night, two different things, both severe problems, and the types of artificial light. The rates follow it identically. That's hard for people to hear and understand as like a cause of, and something that's driving this, but I don't know.
Right. Well, I think that, what's interesting is now that we know the end is there's some type of inflammation that's not being dealt with. Then you have to work backwards and say why. But before, doctors would throw up their arms and goes, well, it just happens. Well, it doesn't just happen.
Yeah,
The
just
rate's increasing. And now that we have some type of, it's like Jeopardy. We know the answer. The answer is inflammation. The question is, how did it get there?
yeah,
What can we do to help our bodies deal with inflammation better?
yeah. Something just magically happened in the 30s. Canner and Asperger started seeing these children from different parts of the world. It was like something going on here.
Right. It's amazing. It's taken 90 years to.
Yeah, and Alzheimer's 1911, and this obesity over the last 50 years.
Right.
What does you said that the process takes about 20 minutes? What does it look like for the person receiving the IV after that?
Um, they usually, well, first of all, if they're not sedated, they feel fine.
Hmm.
The one interesting thing that, the stem cells, the preservative in it has kind of a funky odor. It comes out in your breath. It's so we've heard it described as garlic, corn, strawberries, raspberries, olives. You name it, I've heard it. But I think it's kind of a sweet smell. I would say strawberries. It goes away after about 5 hours. Most people say they sleep really well that night. Uh, but it really is like a little bit of an energy boost. But that's it. The kids that are sedated, once they come out, they're by that afternoon they're playing, they're going to the beach or whatever they want to do. Uh, I think most of you really start to feel good at about 2 weeks because that's when the cells start to migrate out. And I think there's a biphasic thing because the first thing they do is they stop inflammation, and the second thing is they stimulate new uh, cell growth. So even if I inject it in somebody's knee who's got a bad knee, arthritic knee, they feel pretty good for the first couple of weeks just because the inflammation's getting better. But by 3 months, they're going like, my knees never felt good and that this good. And that's because now they're starting to recover that with normal cartilage and get rid of that bone on bone. And I think with um, neurodegenerative disorders, whether it be, Alzheimer's or Parkinson's or autism, it takes a while to start to get those new connections. Because I think there's kids out there that might have had an inflammatory hit, and they might not have a lot of inflammation now, but they have the end result of that. Because I've had parents say, not much is happening, not much is happening, not much is happening, and then at 4 months go, okay, he's a different kid.
Oh wow!
Now we're starting to see crazy things. And I think, if you think of it as a highway, as my wife said, those Bob barricades are up and you just can't get through.
Yeah,
Those Bob barricades start to get knocked down, and then you're starting to get normal, neurologic transmission of electricity. You start to see good things happening.
that's incredible. For the recipients that it just didn't work, there was a small percentage you mentioned earlier. Is this
Yeah, the question is what to do,
yeah?
and
Is it a
uh,
one-time thing?
and nobody really knows that answer. Duke's been doing a lot of the studies. When I was up there talking with them, I said, "Have you looked at the non-responders yet?"
Mm.
And they said, "No, we really haven't." And so the question is, uh, Do they need more? Do they need a higher dose? Do they
Yeah.
need multiple doses? Or is there another cause that may not be the classic inflammation that was seen in that one study? Because right now there's not a great non-invasive way to document inflammation, and you can't biopsy the brain. And so, a phase 1 study in the United States is it safe? A phase 2 study, does it work? A phase 3 study is dosage and administration. And that's where we're just starting to get to phase 3 right now.
Okay.
And so when I did my son, I just, as a medical guy, said one dose is not a trial. I'll try it twice and see what happens. But he was so much better after one dose, it was much easier to give the second dose. But I work with all the parents and I just say, the biggest downside is the stuff is not inexpensive and it may not work, but it's not going to be bad for your child.
Yeah.
But when I looked at, people want you to do supplements. They want you from hyperbaric to all, the speech therapy, the occupational therapy, the ABA, all that costs money too. And if you look at the actual data, the data supports this treatment pretty well. It doesn't work for everybody, but it works for a lot.
Yeah, if you would just even compare it, and even some autistics are given like antipsychotics and stuff like that, was just so wrong. But if you look
Oh,
at,
I agree completely. And so, one of the side effects, this stuff has side effects, but nothing long term. Short term side effects include a rash or a fever, and we usually pre-treat with a little Benadryl and a little hydrocortisone to help prevent that. That can go and come in about the first 6 hours. Kind of midterm side effects. Kids with ADHD can get a little bit more hyperactive. Kids with aggression can get a little more aggressive. It's not continuous. It's episodic. It usually lasts a few months, but then it gets better, and it usually gets a lot better. But I was talking with a family last night, and they said, "Well, our daughter's really got aggressive. We're thinking about maybe we should talk about starting her on antipsychotic." And I was trying to convince them that's not. You just want to manage it. This is a phase. It's been described. It doesn't happen in everybody. In fact, it doesn't happen in most. It happens in about 10% of kids, but it gets better on its own. And antipsychotics are a slippery slope. Manage it at home. And it'll get better. In
yeah,
fact, a lot of kids that we give this to can get off their antipsychotics.
oh, good,
That's a nice thing as well.
yeah, that's fantastic. I don't like the medical paradigm. I'm not a big fan, even though you're a part of centralized medicine. I'm not a big fan of it. But from our conversation today, it makes. I mean, 100% know that not that you need my approval or judgment, but I am just enjoying what you've said so far.
No, I think it was a watershed moment to me when there's such pushback on this. And I'm able to do it because the FDA has already approved it for a bunch of other different things.
Oh
And
yeah.
so the FDA regulates drug companies. It doesn't regulate healthcare. And so if you and I agree that this is safe, it's indicated, and we want to do it, then we're allowed to do it. 20% of all medications in the US are used off label because they're discovered that they're beneficial for something else.
Yeah.
We know 70% or 70% plus people benefit from this. And we know it's safe. Why not use it? And I think that COVID pointed out to me drastically that big pharma is interested in making money, and that there's nothing better than a sick person because then you have a customer for life. And so we've been thinking about managing disease when we should be talking about preventing the disease. And once you prevent it, you can probably figure out how to cure it. And I think that this stuff will offer a lot. There'll always be a role for pharmaceuticals. Antibiotics help save a lot of people's lives,
Hmm.
but not, but people are
Acute.
given antibiotics like chiclets or like candy. And you can't do that either because people are just starting to understand the microbiome. And I
Yeah.
think the next big thing will be there'll be people with a super microbiome. They'll figure out that there'll be a percentage of people that they've got an A number one microbiome. And then we'll use that to put into people whose microbiome have been screwed up due to trauma, illness, antibiotics, genetics, whatever, and try to repopulate their gut with a microbiome we know is much better than their own. And then we can start seeing how that impacts our healthcare.
Yeah, I would. If I had to guess, it would be like athletes or super lean people, super just athletic people will have that super microbiome. And that's why this metabolism is just kind of like an overdrive.
Right. Well, I think we think that these people are genetic specimens, and it might be that their microbiome is better than everybody else's.
Yeah, and that might be the cause. Yeah.
Right, right. Because
Uh,
I think we're starting to see differences in people born by C-section, versus coming through the birth canal, because that's your big first microbiome hit. That might need to happen more than we think.
yeah. Yeah. Okay. That's that's very interesting. Something I learned about the womb and the maternal is she's providing so much serotonin. Her peripheral serotonin is providing so much for the womb's central nervous system, and in large part, autism is that just abnormal central nervous system, and the serotonin is putting together the sensory map and help developing the central nervous system.
Right.
So
And that's why when women take antidepressants, and selective serotonin,
yeah,
it screws up the serotonin
yeah.
system, and those kids can certainly have issues.
Yeah, yeah, autism or other things, autism
Correct.
and
Yeah,
things. Yeah,
right. SSRIs.
yeah, yeah. Um, just a couple more questions. I'm having a heck of a time here. This is so fun. Whenever you mentioned that crossing the blood-brain barrier, I made a note and I just wanted to run it by you. Do you think vasopressin is involved there, whereby it kind of signals or something signals stress, and the vasopressin through the pituitary will open up the blood-brain barrier.
That's interesting because we know the brain is stressed. We know that when injury or inflammation or something happens in the brain, that the blood-brain barrier can be opened um, by internal mechanism, and nobody knows quite what that is, but it could be. I have no idea. All we know is that the cells go from the peripheral blood and they get access, to the brain, and by 14 days, if you induce inflammation in the brain and then give these cells by day 14, they're right there. And if you take the same animal and you don't induce inflammation, they're in the blood system running through the brain, but not into the brain proper. They haven't crossed the blood-brain barrier yet. And what leaks out and tells that cell to stick to the blood-brain barrier, and how does it zip through it? There's these things called tight junctions that are supposed to be tight. Maybe those junctions, slide open for a second, then slide back, and then the stem cells in.
Hmm.
But it's interesting that you can't detect a leak, a wide open leak, yet somehow these cells are in. So they pass through without causing damage. So it could be vasopressin.
Yeah, that's uh, oxytocin and vasopressin is very interesting. Two little molecules. They're very powerful things, and they're very small peptides. There's only like 9 proteins, but they're very powerful. What is something recently that you're most excited about before we wrap up, professionally or personally, or both?
Well, I think professionally and personally, it's probably going to be the stem cells in this. Uh, it took some soul searching and talking with my wife. I've been a surgeon for 30 years. It's what I am. It's what I do. You know, I like to be the guy called when the life is on the line, when traumatic injuries, car accidents, whatever. Uh, but I think that phase of my life is coming to an end because I think that these will be truly healing properties. Not many people are doing it. I think it gives hope to people that need hope, and I think it can restore life like nothing else. And if you can ever figure out how to get the body to heal itself as opposed to a drug or surgery, you're much better off. And
That's
so I'm going to concentrate on this, and
yeah.
I'm going to give up surgery and do this full time, because I've seen remarkable things. I've seen tremendous healing. I had a woman who came in a wheelchair with multiple sclerosis, and after a single treatment, she was walking normally and went back to work. And so I've seen it work, and it's amazing. And so I'm excited for the next phase of my life, to be honest.
Yeah, it's very promising, and it's just the amount of just motivation and hope that it's you're giving me just telling me about it.
Right, right. It's a spiritual journey. I do believe that I was set up to do this. That I had a connection with Duke. I had a connection with UCSF. I
Hmm.
had a connection with stem cells early. And then I've seen it in my plastic surgery practice, and then I saw what it did to my son, and it made him integrate into the world. He lives on his own. He drives a car. He has a job. You know, he's interested in girl. He's had a girlfriend. He's living his best life through completely natural healing that you know most people don't even know about. To be honest, most pediatricians don't know about, and they'll tell you it's crazy. But people who are in this field, especially people way before me, were ridiculed as nutcases. Uh, but that's what happens when you work outside the box. Where you go like, the question is, why why are we seeing all these diseases and we don't have enough sunlight? Why is all this stuff going?
Yeah, I
Yeah, I'm
constantly.
about to lose my battery here. I can either plug in or we can end it real quick.
Oh, yeah. Well, we can end. We've done an hour, and I don't want to keep you, even though I could.
Uh-huh.
I always say a big part of the podcast is like research is right here, and we're just constantly running in this circle. We're like a rat on a rat wheel. Why I'm more interested in and just expanding the edges of science, and I'm thankful you came on because I get the message that's what you're doing.
Yeah, I love, I spend my time reading about this. It's nice that I can pick up a phone and call a major researcher and go, hey, I think our paths are going to cross this way. What have you ever thought about this? And I've called people from Stanford to Michigan to all sorts of people. And the people who are doing it are always interested in the clinician's point, because they're doing the bench stuff. And
Yeah,
I go, I think your research is going to be.
dang. Well, it looks like Dr. Weiss's battery died. That's my fault. I rambled a little bit too much at the end instead of just having a goodbye. And I wanted to mention to him Happy Veterans Day, and I didn't get to do that. So, Dr. Weiss, this will be on the recording. If you listen to it, Happy Veterans Day, and thank you for everything. Thank you for the conversation and your work and pushing the knowledge about this stem cell practice.
I
I,
think you go ahead. You asked me about what I was excited about.
yeah,
And,
yeah. And
and so,
you
yeah,
were talking about the colleagues and stuff. Yeah, go ahead.
right. So there's one guy that I'm really intrigued with, a guy named Bruce Patterson, who was a world class kind of molecular biologist and pathologist from Stanford, and he described a lot of cytokine and chemokine stuff in COVID, and kind of the really molecular markers of inflammation, which really hadn't been studied. And he found out, kind of what was killing people with cytokine storm, but he also afterwards people had what they called long COVID. They had brain fog, they had the stuff, and some doctors thought they were making it all up because all their tests were normal. And what he did was he measured their cytokines, and there's 11 billion different combinations of cytokines, and he found out that they all had the same pattern. And so there was something molecular that was happening in these long COVID patients. And so he took 18 people and found out it was all the same. And then he showed that if you keep treating them and you drive down their cytokine levels, their symptoms got better. Then he decided to look at 45 people who all had long COVID just to see if he could reproduce his results. And then he found out that 40 had the same pattern of long COVID, but these 5 people over here had a different pattern, but they all had the same pattern. So then he said, these people have long COVID, these people have something else. And
Huh.
then he looked at their medical history. They all had Lyme's disease. Then he goes, okay, Lyme's disease gives you a pattern. And then he said, I think I found a pattern for pandas. So I heard about him and I called him and I said, Bruce, Eric, we introduced ourselves. Uh, and I said, you think there's a pattern for autism, that there's going to be a basic pattern of inflammation that we can pick up on the cytokine level? And, he said, I don't know, let's do it. So we've taken blood on about 6 or 7 kids now, and we've looked at 14 or actually 12, 13 different cytokines. And the most normal kid had 12 or 10 abnormalities out of 13. So they're profoundly inflammatory state. And so now we're trying to put it together. We're trying to get maybe 30 that we can get, the informatic guys to look at and go, okay, this looks like a pattern. These two are the same. What's different about this kid? Let's get more medical history. But I think 2 things can happen. One is that we now have something we can measure in autistic kids that we can say, oh, we're getting better. Look, his inflammatory markers are dropping.
Hmm.
And well, first of all, as inflammation drops, does that correlate with getting better? And if it does, then we can really, really press it. And the same thing, you could use it almost as a diagnostic tool too.
Yeah.
Yes, this 18-month-old, something happened here, and then you could start saying, okay, well, their initial blood sample at the hospital didn't have this inflammation. Is this acquired? Because in that initial autopsy study, they had blood, or they had brains from kids that were so-called neurotypical and then degenerated or regressed into autism. And then they had kids that were never good, that always had it.
Yeah.
And the interesting thing is they all had inflammation in the same place.
Huh.
And so now we're starting to think that there's something called maternal immune activation, MIA, where if the mom gets infection or some type of inflammatory hit, they can transmit to that child. Or if the child gets an inflammation early on when they're young, whether it be COVID or some other problem, um, that neuroinflammation can cross the blood-brain barrier. So it just opens up a lot of directed research, So I think that's exciting, but just uh, that's the most exciting thing happening in my life right now.
Wow. That is exciting. What about those patterns? Cytokines, if I'm not mistaken, they're some of the roles, or the role there, are cell signaling, and a part of cytokines is interleukin. Is that
Yeah, yeah.
right?
Interleukins are cytokines. So
Okay.
yeah, right. So you've got interleukin 2, 4, 5, 6, 7, all the way up to
Yeah.
35. Every time they figure out a new cytokine, it's an interleukin 42A or
Okay.
42B. So yeah, they're the cellular communications of inflammation. That's the lowest molecule there is. They're the ones that turn on the whole immune system. And
Oh,
so these kids and adults have issues with their cytokines and chemokines. And so now we just have to figure out when it all started and how to turn them off.
I see the interleukins in autism papers a lot. So
Correct.
yeah, it
Yeah.
seems like that's the path there. It's You're onto something there with the patterns. I'm,
Right.
I'm extremely excited about that. I'm going to look up the Bruce Patterson doctor and kind of.
Yeah. He would be an interesting guy to talk to. He might talk to you. Most of his work is done with inflammation and disease, but I think he could tell an interesting story about COVID and long COVID and Lyme's disease. Stuff that most people don't know about immune activation and how to treat it.
Yeah. Okay. How, how can people get a hold of you, and if you want to share, and um,
I think
I'll,
there's two things I would share. One, ericweissmd.com, is one website, but northfloridastemcells.com is my main one. But my wife wrote a book called Educating Marston, who is my son with autism. And it's everything we did for him. The one bad thing about autism is that, if your kid gets leukemia, there's a playbook, but as soon as your kid gets autism, the pediatrician kind of, pats you on the back and says, go get therapy. But there are things we did that worked. There are things we did that didn't work. My wife was very honest. But I wrote the middle three chapters on stem cells, kind of on the biologic basis of why they should work and how they work. And I think that'll give people a very nice baseline to know that this stuff has been studied a lot. It's not new to medicine. It's a new application for an old drug. It's safe, and maybe it's something they want to do.
yeah, good.
And Educating Marston can be found on Amazon or Barnes and Noble or Books a Million, all those.
Great. I'll definitely put show notes. There'll be links in the show notes.
Oh,
I'm
thank
excited
you.
about that, and um, I just loved our conversation.
No, I'm looking forward to seeing it. Nice meeting you as well. Where are
Yeah,
you located?
Tell City, Indiana. It's southern Indiana.
Southern
It,
Indiana.
it's about 2 hours south of IU,
Oh,
about
okay.
about an hour west of Louisville, Kentucky.
Oh, okay.
Yeah, it's a very small town.
Well, keep doing what you're doing. You're bringing knowledge and power to a bunch of people.
Thank you. Yeah. I didn't want to the other recording ended before I could say this, but happy Veterans Day, and
Oh,
thank you
thank you.
for your service.
No, no, no. I did my little bit, so glad to help out. Thank you. Have a good night.
Thank you. Thank you so much, Eric.
Bye bye.
Bye. If you are listening to the podcast or listening to the episode, please feel free to leave a review or ratings. In podcasting, review and ratings are crucial, and I very much appreciate your feedback. You can contact me on X at RPS 47586 or click on the hop link so you can have links to all the show platforms and contact information. You can email me info.fromthespectrum@gmail.com. And thank you for listening to From the Spectrum podcast.